Ladies and gentlemen, it's another episode on Time with a Gynae. This is Dr. KK. I'm coming your way today with an interesting conversation or information on your menstrual cycle. Over the past few days, I've been talking to you about your menstrual cycle, and I've told you what appears to be normal and what is not normal. And I'm sure you've been following that episode. If today is your first time on this channel, pause, subscribe, like all my videos, and share for others to also benefit from all that are on this channel. So today I want to answer or respond to some questions that came based on the previous episodes. People are asking, after my menses, I still see blood on a few days. I see spotting. What is it? What could it be? Is it also normal? So when it comes to that is described as abnormal uterine bleeding or abnormal bleeding, and there could be physiological causes and there could be pathological causes, right? So when it comes to, I'm going to take you through a few of the pathological causes or the ones that indicate that there could be a problem. One of it, and the foremost one I want to speak on, is excessive weight gain. So if you have excessive weight gain, it has an influence on your menstruation. So you could be seeing spots, and sometimes you could even bleed beyond the number of days you are supposed to bleed. All those could be as a result of the fact that you gain more weight. Sometimes too, your menses may not even come at all. All those could point to the fact that you've gained excessive weight. And guess what? If you have lost too much weight too, that also has an impact on your menses. So when I'm talking about weight, I make reference to BMI, which is the body mass index. And the values or reference ranges we are using are 18. If it goes below 18, it means that you are underweight and you have lost so much weight, which also has an effect on your menses. If your BMI is going beyond 30, then you are obese. Sorry, but that is over the required threshold, and that can have an influence on your menses. One other thing that is very key is the use of emergency contraceptives. So the post pills that are taken can also have an influence on your cycle, such that you may bleed intermittently or you may spot on days that you are not expecting to see blood. So I've spoken about the weight, I've spoken about the use of emergency contraceptives. I want to advise that if you have to be using emergency contraceptives all the time, then it's very important that you subscribe to a long-term or medium-term family planning method so that you don't have to be using the emergency contraceptives every time, right? So aside that, one of the other causes are things like PCOS. PCOS, the name has been changed to PMOS. So that is a problem with ovulation. So it has to do with some hormonal imbalances such that it has an impact on your menses, and then you are not seeing your menses as you're supposed to see it, or you have bleeding in between your menses or spotting in between your menses. One of the causes that could lead to spotting or intermittent bleeding even after the normal menses is pelvic inflammatory disease, what is commonly called PID. PID is an infection that affects your upper genital tract, which includes your womb, the ovaries, the fallopian tubes, and your pelvis. So any infection that affects all these areas can also lead to some intermenstrual bleeding or some spotting that you may see. Some rare causes may be cysts, like ovarian cysts. So some of the cysts that happens in your ovaries may lead to some intermittent bleeding. So that's also one thing you should take note of. Additionally, one of the causes of spotting or bleeding beyond your menses could be something like an infection at the entrance or the cervix. The infection over there, which we commonly call cervicitis, can lead to some bleeding, some spotting. So if you are seeing any of these bleeding or spotting, it's very important that it is distinguished from the physiological forms of bleeding. Any use of some medications can also lead to some form of spotting or bleeding beyond your normal menses. So medications like antipsychotics, antidepressants, anticonvulsants, all those medications may also lead to you seeing some spotting. Some antibiotics also have an effect on your menses such that you may be bleeding around the times that you are not supposed to bleed. You may be seeing some spotting. All these things should be taken note of. That is why I encourage you that as a woman, if you have any problem, it's better to be assessed and giving the right medications. Because on one episode, I will talk to you about the effect of antibiotics, excessive use of antibiotics on the woman in terms of your vaginal flora, in terms of your menses. So let's take note. Use of antibiotics, some of the antibiotics can also lead to spotting or bleeding beyond the days you're expected to bleed or outside your menstrual cycle. So let's take note. If you're having spotting, if you're having bleeding, all these are important to be assessed. All these are very important to be assessed. One other thing that can also affect your menses, such that you may spot or you may bleed at when you are not supposed to, is psychological or physical stress, excessive psychological or physical stress. That can indeed make you spot. It can make you bleed because stress or excessive physical or emotional stress has an effect on your hormones. It can cause hormonal imbalance, and it is all this bleeding outside your menses is influenced by hormones. So anything that causes hormonal imbalance can have effect on your menses or the pattern of bleeding. So maybe too much stress from work, too much stress from home, from wherever, can lead to your seeing some bleeding. One of the other things that can lead to bleeding is if you are using IUD, the family planning method that prevents, it's a long-term family planning method. So that's, for some women, they also report of spotting some bleeding, and research has shown that yes, indeed, IUD can be the cause of some spotting or some prolonged bleeding. So let's take note. If all these things are happening, or if you have spotting, if you have abnormal bleeding, look at these things and let it be checked for maybe that may be the cause of your bleeding. So yes, any bleeding outside your normal menses, there's a cause. It may also be physiological. Most of the times, it may not, if it's not bothersome. There are sometimes the bleeding may not be so excessive and you can still go about your normal daily activities. But there are times that it becomes so excessive that you may need some treatment at the hospital. So if your bleeding is coming in such a way that is not normal to you, please visit your doctor, visit your midwife, let them assess you and see if there's a problem. If there's a problem, that will be handled for you so that you can have your menses back to the normal that you were experiencing. I want to sign out here today. I spoke to you today about abnormal bleeding, and I've given you some of the causes of this abnormal bleeding. So if you are seeing any of them, or if you have any questions, don't forget to put it in the chat box. I'll be glad to respond to all your questions. It's another time with the gynae. I'll come your way again with another session on your menses. See you again in the next one.